Let's clear up one of the most common and frustrating myths in women's health, and that is that you cannot go on hormone replacement therapy if it's been 10 years since menopause or you're over the age of 60. The fact of the matter is, this is not supported by current research, this is not the current guidelines, and it's a misunderstanding, especially when we're talking about bioidentical hormones. But where does this misunderstanding even stem from? It comes from the Women's Health Initiative, which was released in the early 2000s, and the average participant in that study was age 63, and most of the participants were 10 years past menopause. The hormones used in the study were also not bioidentical hormones, they were synthetic hormones. The study found that the women who were on the synthetic hormones had an increased risk for stroke, heart disease, and for breast cancer. The current research on bioidentical hormone replacement therapy shows improvements in cardiovascular health, bone density, and cognitive function in menopausal women. While these benefits appear to be more pronounced in women who begin hormone replacement therapy earlier, they're still observed just to a lesser extent in women 65 or older. Importantly, these studies show no significant safety concerns, making it a valuable option for women who are still experiencing symptoms. So what do current guidelines say? The North American Menopause Society clarified its position statement in 2022, saying initiating hormone replacement therapy in healthy women aged 60 or older more than 10 years from menopause onset may be appropriate if there is clear indication and no contraindications. Lower doses and transdermal routes may improve the risk to benefit ratio. Now, how do we optimize safety? Because the route matters. Estradiol, estrogen, should always be given transdermally. It should never be oral. I never prescribe oral estradiol. This usually looks like a gel, a cream, or my favorite is a patch. And then progesterone should be micronized and bioidentical. It should be regularly monitored by a doctor, and it's always important to stay up to date on current preventative healthcare measures. No woman should still be struggling with perimenopausal or menopausal symptoms. And if your doctor is telling you that you don't qualify for hormone replacement therapy just because of your age or because of your time since menopause, they're wrong and they're using outdated guidelines. Also, the FDA is holding an expert panel meeting on HRT for menopausal women tomorrow. So I'm really interested to see what they're going to say and how this might change things, hopefully for the better.